Some medical emergencies are incredibly serious, life-threatening events that require you to recognize and act on them immediately. Today, we're going to dive deep into two of these critical situations that you might encounter: acute pulmonary edema and cerebrovascular accident, also known as a stroke. Understanding the signs and knowing what to do can truly make the difference between life and death. First, let's talk about acute pulmonary edema. This is a severe, often sudden, complication of congestive heart failure. So, what exactly happens when congestive heart failure becomes uncontrolled? It means the heart isn't pumping blood effectively. This causes a backup of pressure, and fluid starts to rapidly accumulate in the air sacs of the lungs. This isn't just a minor issue. It's a full-blown medical emergency that leads to significant respiratory distress. The lungs are literally filling with fluid, making it impossible to breathe properly. The symptoms are alarming and escalate quickly. The most prominent symptom is difficulty breathing, what we call dyspnea. This gets significantly worse when the person is lying flat, a condition known as orthopnea. Because of this, patients often try to sleep propped up on several pillows. Sometimes they might wake up suddenly in the middle of the night, gasping for air. This is called paroxysmal nocturnal dyspnea. You'll also notice their breathing is very rapid, or tachypnea, and they might have a wheezing sound as air struggles to get through the fluid-filled airways. It can look like they're hyperventilating, taking fast, shallow breaths out of desperation for oxygen. There are two classic telltale signs that should immediately make you think of acute pulmonary edema. The first is pink, frothy sputum. This is a mixture of air, fluid, and red blood cells from the lungs being coughed up. If you see these, it's a major red flag. But the fluid overload doesn't just stay in the lungs. It affects the entire body. The person's skin might feel pale, cold, and clammy to the touch, and they may be sweating profusely. They could experience palpitations, feeling like their heart is racing or fluttering. You might also see peripheral edema, which is swelling in the hands, ankles, and feet. Internally, organs can become enlarged, such as the liver hepatomegaly, the spleen's splenomegaly. Fluid can even accumulate in the abdomen, a condition called ascites. All of this puts an immense strain on the body, leading to profound fatigue, weakness, and a sense of overwhelming anxiety. Another less obvious sign is nocturia, which is the need to urinate frequently at night as the body tries to get rid of excess fluid. When you recognize these signs, you must act fast. This is a true medical emergency. First and foremost, call 911 immediately. While waiting for help, have the patient sit fully upright. This position helps gravity pull some of the fluid down to the base of the lungs, making it a little easier to breathe. If oxygen is available, administer it. If the person has been prescribed nitroglycerin and their blood pressure isn't too low, it can be administered to help dilate blood vessels and reduce the workload on the heart. Throughout this entire process, you must continuously monitor their vital signs. Now, let's shift to our second life-threatening emergency. A cerebrovascular accident, more commonly known as a stroke. A stroke happens when the blood supply to a part of the brain is suddenly interrupted or severely reduced. This deprives the brain tissue of essential oxygen and nutrients, causing brain cells to start dying within minutes. The result is a sudden onset of neurological deficits, and the specific symptoms depend on which part of the brain is affected. The warning signs of a stroke are often sudden and dramatic. A person might experience sudden dizziness or a spinning sensation called vertigo. A severe headache that comes on abruptly with no known cause is another major warning sign. They might have trouble speaking or understanding speech, a condition known as aphasia. You might notice other neurological deficits, like a transient tingling or numbness, which is called paresthesia. One of the most classic signs is unilateral weakness or paralysis, where one side of the face, one arm, or one leg suddenly becomes weak or completely unable to move. In severe cases, a stroke can cause convulsions or even a complete loss of consciousness, leading to a coma. Vision can also be affected. A person might experience transient monocular blindness, which is a temporary loss of vision in one eye, like a curtain falling down. Other vision changes, like blurred or double vision, can also occur beyond the neurological and visual signs. The body can react with nausea and vomiting. Some people also experience sudden sweating and chills, even without a fever. Here's a very important clinical note. Especially for exams and real-world assessment, blood pressure and pulse are often normal in the early stages of a stroke. You should never rely on normal vital signs to rule out a stroke. Changes in vitals, like a high blood pressure, high temperature, low pulse, and slow breathing, typically only appear in advanced stages when intracranial pressure has built up significantly. By then, it might be too late. Just like with pulmonary edema, management begins with an immediate emergency response. Call 911 without any delay. Time is brain, and every second counts. While waiting for paramedics, administer oxygen if it's available. Keep a close watch on their vital signs. A crucial point here is to not give the person anything to eat or drink. Don't give them any oral medications, not even aspirin, unless specifically instructed by emergency services. This is because their ability to swallow may be impaired, and they could choke. If the patient becomes unconscious, your priorities shift to basic life support. Follow the CAB protocol. Compressions, airway, breathing. If they are not breathing normally, begin CPR. If they have a pulse but are not breathing, focus on maintaining their airway. Use the head tilt, chin lift maneuver to open their airway and ensure they can get oxygen. Be prepared to act quickly if their condition deteriorates. The key takeaway for both of these devastating medical emergencies is that early recognition saves lives. Knowing the signs of acute pulmonary edema and stroke, and taking rapid decisive action can dramatically improve the outcome for the patient. Thank you for watching. If you found this information valuable, please follow our channel for more medical emergency education. Stay safe and stay prepared.